So, hello, my name's Kate. I couldn't start a talk in any other way these days, and I'm going to tell you a bit more of the story of how #Hellomynameis was born and why that four-word phrase has become very important and quite magical in Chris and our lives. I don't mind if you want to tweet today. I won't think you won't offend me by getting your phones out. So we have a hashtag for the tour, so it's HMNI tour, and if you could use that, then we're going to storyfy all the tweets at the end. So we've tried to have a connection with all the places that we've been to on the tour, and you're visit number 13 out of 16, so my voice is really struggling now. And I don't actually have much connection to the northeast at all. But the only time I've ever been to Darlington, and I know Darlington's linked to your trust, is to go to a funeral. And that's a bit sad, isn't it? I went to my friend Kate's funeral. She was the first friend I made at university, and 8 weeks after we started university, she jumped off the crags in Edinburgh. So we came down to the funeral at that church, which is near Darlington. So that's my personal connection to this place. So if we rewind a few years, it's July 2011. Chris and I are just a normal Yorkshire, happily married couple, nothing special. He's working his way up the management ladder at Asda, and I'm in my third year of training to become a medicine for older people consultant. I'm happy. We're thinking about having a family. We've got great family and friends. We've got a lovely home. And we decided we'll take a holiday. And we're lucky that Chris has family in California, so we went off to California to enjoy some sunshine. And as you can see from that photo, the weather's absolutely perfect. And we're at a vineyard, because obviously if you go to California, you have to go to a vineyard. But that smile's a little bit forced, because I'm not feeling very well. The moment I got off the plane, I started to feel quite poorly, actually. I had this right-sided back pain that I just couldn't get rid of. I was feeling tired, lethargic, and just gone off my food and a bit sickly. And I didn't really know what was happening, but I was being your typical doctor and just ignoring it. Until my symptoms got so bad that actually Chris took charge of the situation as a sensible non-doctor in our relationship and decided actually it was time to do something about it. So we ended up in a hospital in America where I had some pain relief and some antiemetics, and they did some blood tests. And they came back quite soon after they'd sent those blood tests off to say that actually, Kate, you're really sick and you've got renal failure. My creatinine was over 600. The reason for that was that my abdomen and my pelvis were full of tumours blocking both my ureters. Bang, out of the blue, age 29, with no history, no family history, I'd got a diagnosis of cancer. Obviously that was a very tough time. We were thousands of miles away from our friends and family. Chris was having to do all the communication on the phone, and everyone was just really struggling with what was happening to us. The American urology doctors put some stents into my ureters to get my kidneys working again, and luckily that worked. So I got well enough to get back on a flight to come home. And then we started our journey with the NHS. I was referred on the gynecology fast track by my GP with my presumed ovarian cancer. And very soon after that, I was readmitted to hospital. I developed renal failure again as my stents failed. I had to have bilateral nephrostomies inserted. I had a really severe episode of pyelonephritis. Now, at that time, I thought I wasn't going to get better. I thought, this is it. You know, I'm never going to get well enough for any form of cancer therapy. I'm just going to die now. But things started to improve gradually. And while that was happening, the histopathologists were trying to work out what was actually wrong with me. Because I knew from the moment that they put the slide under the microscope of my biopsy that I didn't have ovarian cancer at all. That actually I had something much rarer going on. And it took them 3.5 weeks to work out the mystery. And after they'd done all their fancy immunohistochemistry and things, they came back with an answer that had got a very rare and aggressive form of sarcoma. It's called a desmoplastic small round cell tumour. It affects 1 in 2 million people. It had already spread to my liver and my bones, so I was therefore in a palliative, non-curative situation. And that was me, with my diagnosis that I wasn't going to get better from. That was a tough time. We had a lot of discussions around what was going to happen. I had the option of just going home and receiving palliative care and not trying any treatment at that point, or I could try some really quite intensive palliative chemotherapy. The trouble with this cancer is you can't just tickle it with a little bit of gentle chemo. If you're going to do something, you have to go the whole hog. There's also the risk that if you do that, then a big proportion of patients with this cancer don't respond at all, and then you end up medicalising the final weeks and months of your life. So that was obviously big decision time. I'd been a senior SHO in haematology, so I kind of knew what chemotherapy looked like from the doctor's side of the bed, but little did I know what I was really letting myself in for. So because everything had been so sudden, and my oncologist thought it was worth a shot giving the chemotherapy, and Chris and the family wanted us to try, so we decided that we would go for it. I had 5 cycles of chemotherapy. It was very tough. I had febrile neutropenia every single time. I needed multiple blood and platelet transfusions. I was really very sick. I had hemorrhagic cystitis from my cyclophosphamide, and yeah, every complication seemed to happen to me. But the good thing was that despite all this illness from the treatment, my cancer was responding. The lumps were getting smaller in my tummy, my scans were getting better. So after 5 cycles, I had been reassessing the burdens and the benefits every single cycle, and after 5 cycles I kind of decided the burdens were outweighing the benefits of treatment, and that was at the end of 2011. I really wanted to do one thing at that point, which, crazy as it sounds, I wanted to go back to work. I'd been told by my oncologist in the August that I probably wasn't going to work again, and I was absolutely determined to prove him wrong. So 3 weeks later, I was back on the wards at Pinderfields at the stroke unit at the time, looking after older people, which is what I love to do. We then had a period of time of 18 months where I was really very well, and this was unexpected. Diagnosis to death in this condition is 14 months usually, so to get 18 months of quiet cancer was really, really nice, and we did lots of things in that time. We ticked the bucket list. We had a really good, fantastic quality of life. I managed to progress with my career, and things were going really very well until September 2013. When I started to feel a bit poorly again. I had some partial bowel obstruction type symptoms that were really difficult to control, and I was developing more and more pelvic pain, which sort of heralded me contacting my oncologist again to say, should we do a scan, and if so, what will we do with the results? So I had a scan, and that confirmed that everything was progressing, and it was time for decisions again. Because I'd had such a good response to chemotherapy the first time round, we decided that it was a reasonable idea to pursue chemo again. We had 4 cycles this time. It was equally as tough. I started having problems with multi-resistant organism infections because I'd had so many antibiotics, and I was very sick during that time. But I got better, my cancer responded, and I got back to work. I even progressed my career enough to act up as a consultant in the specialty that I love, which was amazing to be able to do the job that I'd spent 10 years of my life training to be. During that time, however, I had those telltale signs of cancer progression, the tiredness that doesn't get better by sleeping, the worsening tummy pain, and I was really in 2 minds about what to do. I eventually got the courage together to ask my oncologist what we should do, and he was very pro getting a scan, as oncologists often are. So I had a scan just before Christmas that confirmed everything was on the move again. We kept that from the family over Christmas because we wanted to have a nice Christmas if it was going to be my last. And then we did the difficult task of telling everyone after Christmas, and I went to see my oncologist to discuss what to do. Because I'd had so many of the drugs in the first 2 cycles, I couldn't use a lot of those drugs again. I'd had my lifetime limit. So we had to change chemotherapies, and the new chemotherapy really didn't suit me very well at all. I had intractable vomiting and spent 2 days on the bathroom floor. It was horrendous. I managed to get through 2 cycles, both complicated by febrile neutropenia and time in hospital. My cancer did respond to some extent, which was encouraging, but I just couldn't do it anymore. And I think I'd just come to the end of my chemotherapy career. I'll never say never, because if I survive another 12 months, then maybe I'll give another 2 cycles a go. But at the moment, we're kind of anti-chemotherapy. So that's my story. That's what I've been through in the last nearly 4 years in a nutshell. And during that time, I've been through so much healthcare. I've met so many members of NHS staff. I've spent time in side rooms, and it's given me time to reflect on all these interactions. It's given me time to think about what makes a good doctor, what makes a good nurse, what is care. And all those reflections have helped me to think about what could I do better to be a better doctor, but also how can I share to make experience better for other patients. And it kind of spent time distilling my thoughts and kind of distilled them into my core values that are really important to me as both doctor and patient. Now, it's very trendy to have organisational values. I'm sure you all have organisational values here at this trust. But I think it's also important to think about your own values, because they may be different from the organisation that you work for. And I've got 4 interlinking things that are really important to me. They do all sort of interlink, and they're all very simple things. It's not rocket science at all. So the first thing is communication matters. How we communicate with people and how we learn to do that through our careers as healthcare professionals is a lifelong journey. You can never just tick a box to say you've been on the communication skills training. It's something that you develop through hundreds and thousands of interactions between human beings. When communication is good, I tend to have a better experience. When people are sensitive and think about the impact that news is going to have on me, I tend to have a good experience. When communication is perhaps a little bit more clumsy or maybe a little bit rude, that tends to be linked to poor experience. And anyone who deals with complaints in the room will know that the nub of the problem is usually communication. The second thing that matters to me is little things. Little things make the biggest difference to patients. We all do tiny acts of kindness every single day for our patients without even thinking about it. But they're the things you take away and remember as a patient. They're the things that make a difference between a good experience and a poor one. When I say the little things, I mean somebody sitting down beside you instead of looming over you on a ward round. Perhaps somebody holding your hand when you're feeling a bit upset. Perhaps somebody giving you an extra moment of their time so that you can express your fears and anxieties. Maybe somebody introducing themselves. They're all things that we can do. Everyone can do them. They take very little time and they make all the difference. I'll always remember Kat, a staff nurse who works in Leeds. She noticed one evening, well, it was about 2 o'clock in the morning actually, that I was in pain. I was awake and in pain. And I didn't have to tell her. She noticed from my body language. And she got me painkillers without me having to ask, because I've had a lot of sort of staff attitudes in the past where I've been made to feel a bit like I'm opiate seeking sometimes. But she got me painkillers without me having to ask. She made me a heat pack and she sat with me till my pain resolved. I'll always remember Kat was so kind to me that evening, and she was doing those little things that people really take away from their experience as patients. The third thing that matters to me is person-centred care. Now, this is a phrase that's bandied around the NHS quite a lot, but I'm not sure we ever really stop and think about what it means. As a patient, I've quite often felt like I'm just on the periphery and people are making all these decisions about me and I'm not involved. Now, I want to be involved in every decision about my healthcare. That's part of who I am. Some patients don't, but it's important that we find out who they are and how we can deliver that person-centred care. And kind of linked to that is my fourth value, which is about seeing me as a person. Not just that girl with DSRCT, not even, perhaps even worse, bed 7, would you like a cup of tea? These things have happened to me, and it's shocking, isn't it? Being in hospital is a dehumanising experience, no matter how lovely and kind the hospital is, because we strip people of things that they can normally manage independently. So we tell them when they can eat and what they can eat, we tell them when they can sleep, we take their medications off them and then we give them back at the wrong times. You know, these things we do to people, don't we? And then if we take away their names and refer to them as diseases or bed numbers, then that's just so wrong. I always tell the story of a lady that I look after at Pinderfield who's a world record breaking speed knitter. Now, unfortunately, she developed dementia and she had some quite challenging behaviours in relation to her dementia. But the way to calm this lady down was not by reaching for the haloperidol, it was by reaching for a ball of wool and a pair of knitting needles, and it worked a treat. Knowing that about that lady helped us to live a better care. So seeing the person behind the disease is key. These are my stents. They're very important to me. They mean that I can live an independent, free life without nephrostomies dragging behind me the whole time. They have to be replaced every sort of 6 to 12 months because they get a bit gunky. So I had that surgery in August 2013 and everything went very, very well. I didn't have any problems and I was out of the hospital the same day. Unfortunately, 36 hours later, I developed a fever at home and I was rigouring and I felt really quite poorly. So dragged back to hospital by my lovely husband, kicking and screaming, and we went through the emergency department, which is an unusual experience for us because we normally go direct admissions to oncology, so having to go to an emergency department was kind of a new experience. So we were triaged by a nurse that I used to work with, and it was nice to see Katie and catch up with her. And then one of the junior doctors from the surgical team came to clap me in, and he was one of the doctors. It's really hard to extract his name and his role. I did eventually manage it, but it was hard work. Then a clinical support worker, a healthcare assistant, came to cannulate me and take my blood cultures. And she didn't have a name. She barely interacted with me during that. Then a nurse came to put my antibiotics up. She didn't have a name. More importantly, she didn't check my name or my allergy status. And the whole time she was talking to another nurse about another patient. So I felt like one of those mannequin arms you get in clinical skills centres. There was no need for me to be there, really. Then I met Brian. And Brian restored my faith somewhat. He was a porter. He had a name. He recognised that I was in pain as I got onto his trolley. He got me an extra pillow and a blanket so I was comfortable. And then he took extra care pushing me over the bumps in the corridor of St James's. The whole time he was talking to me and Chris. I hate being pushed around a hospital that I know, knowing that at every turn you might bump into somebody that you know in a professional capacity, and they might either blank you or have a really awkward conversation with you, neither of which are pleasant. And Brian took away all that fear, all that anxiety, just by talking. He was doing the little things that really matter. I was then in hospital for just under 2 weeks with my post-op sepsis. During that time I met lots of people, and the majority of them didn't introduce themselves to me. The consultant on the post-op ward round didn't introduce himself. Lots of the nurses who did my antibiotics didn't introduce themselves. Lots of the healthcare assistants doing my observations didn't introduce themselves. But when somebody did, it made such a difference to my day. It made me feel human again. I'll always remember staff nurse Georgie. I can still remember her name 2 years on. She introduced herself in the morning with, "Hello, my name's Georgie. I'm going to be looking after you today. Just press your buzzer if you need anything, and can I get you anything just now?" It made such a difference, that 30 seconds of interaction. Because being in hospital is lonely. That sounds really strange, doesn't it? Because we're surrounded by people all day long. But actually, we have the interactions with the people that we love restricted, and we have very brief and often meaningless interactions with the people that are around us. So if somebody actually makes the attempt to connect with you, that makes all the difference to how you feel as a patient. So one evening, I was discussing with Chris about how we could think about these lack of introductions and what was going on. And I would call it passionately reflecting, but Chris calls it ranting. We had a discussion around what we could do to improve things. And that's where Hellomynameis was born that evening on the 31st of August 2013. And this is the first tweet I ever sent about the campaign. We thought what we could do is something positive, because complaining doesn't change anything, does it? It's not going to change the culture and the behaviour on this one particular ward, and it's not going to change things for other patients elsewhere. So I thought, well, we could use my already significant social media influence to do something positive, to remind, inspire and encourage people about the importance of introductions in healthcare, and get a conversation going in the social media space. So if you're going to do that, then you need a catchy hashtag. So we came up with Hellomynameis, and that was actually Chris's idea, and he likes to take the credit for that. So credit where credit's due. We designed a logo for the campaign to give it a visual identity. And as part of that logo, we incorporated a smile. Because it's not about just saying the words, it's about how you say them as well. And it's very difficult to look somebody in the eye and say, "Hello, my name's Kate," without smiling. I challenge you to try it sometime. I blogged about the campaign to give people the opportunity to pledge their support. I got my very clever IT geek brother to design us a website which incorporated resources and links to information and pictures. And I started being asked to write for various healthcare journals, to write various guest blogs, and to be interviewed for various publications. And all of a sudden we seemed to have a social movement on our hands. It just seemed to happen. I'm not quite sure how, but Hellomynameis seemed to strike a chord with everyone who works in the NHS. This is something simple that we can do at no cost that improves the patient experience. So Hellomynameis started to pop up on people's lanyards, and I see an awful lot of Hellomynameis lanyards before me. People started to have name badges, it was on screensavers, people had ward introduction boards, people were having their own little selfie campaigns, chief executives were blogging about it, there were balloons, cupcakes, students, paramedics, all sorts of people were involved. Then I went to Paris in 2014, and the reason I went to Paris was to go to the Quality Forum, because I'd had a poster accepted all about the campaign, which was great. So I took my very colourful poster along to Paris, and I was also invited to speak in the social media meeting about the campaign as well. But what was interesting in Paris was that I kept seeing Hellomynameis popping up elsewhere. People on the big stage were talking about it, and people kept coming up to me and saying, "You're Kate Granger, aren't you? Hellomynameis," and all this. And I was just like, that was the first time really that I realised that this had gone bigger. It had really sort of outgrown Twitter almost. We had some stickers at that meeting which we went round sticking on people's badges, and I managed to indoctrinate one of my own healthcare heroes, Don Berwick, which was cool. At the time I was working at Leeds teaching hospitals, And this was a patient experience in a Leeds teaching hospital. So I really wanted to do something there. So I went knocking on the door of the chief exec there and I said, Julian, I'd really like to bring Hellomynameis to Leeds. And I'd like Leeds to be the flagship Hellomynameis trust. And he was so supportive of the idea. Immediately got the medical director and the chief nurse and started hatching a plan. And the plan we hatched was to start with the pledge. And the pledge was about always introducing yourself to patients and visitors, but also about treating patients with respect and dignity, trying to see the person behind the condition, and treating people as you always would your own family member or loved one. And that's a piece of advice that I was given when I started my medical career, and I've kept as my mantra throughout. We went round collecting photos of people posing with their teams or by themselves, and the comms team managed to get 1,000 pictures, which are now going to be a big photo wall. Let's see, you've done something similar here. And it started to become part of culture. So whenever they had a Leeds Way event, Hellomynameis is part of that. It's become part of the corporate induction for all the new starters in the organisation as well. As part of my work in Hellomynameis, I've been asked to do a lot of conferences. So I closed the NHS Confederation conference last year, which was a fairly big audience of nearly 1,000 people. And I also spoke at the Expo last year as well, together with Chris, where we launched the inaugural Kate Granger Compassionate Care Awards. These awards were sort of created by NHS England to celebrate the work that I've done to promote compassion. And that it's really nice because we have too many sticks in the NHS, don't we, and not enough carrots. And this award's really for anyone. It doesn't have to be a really well-connected consultant. It could be a healthcare assistant who wins. And so we've just received the shortlist for this year's awards, and we're really looking forward to the impossible task of choosing a winner. And I also need to concentrate on staying alive so I can present them in September. Familiar faces there, isn't there? He's my chief executive now. So if you have a good idea that takes no time, costs no money and improves patient experience, then politicians want to be involved. I believe it's called getting on the bandwagon maybe. So we've been to see David Cameron at number 10, and he dutifully did his photo call outside that famous front door for us. Jeremy Hunt's been supportive of the campaign, although in his first time he mentioned it in a speech, he didn't tell me, so he had a little bit of a hard time on Twitter. But we've made up now, well, as much as I can make up with the Health Secretary. We've been to NHS Scotland and the Scottish Parliament and spoken to Nicola Sturgeon, and she was very engaged with the campaign as well, which was great. If you turn to page 36 of the government's response to the Francis inquiry, then you find a box all about Hellomynameis. I did have a picture of Ed Miliband on this slide, but after the election, I'm sure it was still appropriate. You might think this is a little bit gimmicky, getting celebrities to do this pledge, because you might think, well, what have they got to do with healthcare? I think it's actually really good to raise the profile of something like this, get the public talking about it, get us talking about it, and once people start talking, they start thinking, and when people think, they change behaviour. So I am actually very proud of our little Hellomynameis celeb posse. It's difficult to measure the impact of something like this because it's about whole culture and whole person care. This interaction that I'm talking about today is happening in your hospital hundreds of times right now. Some people are trying though. They're measuring patient experience, they're asking questions about whether people introduce themselves as part of patient experience surveys. We were in Leicester on Wednesday and they showed us some amazing results before and after their introduction of the campaign, and I think your chief exec was kind of alluding to some positive results from your work. Some junior doctors are doing sort of traditional quality improvement projects by using the campaign as their kind of driver for change. But I can't do any of that from Hellomynameis headquarters in Wakefield. I have to look at it on a bigger picture and a wider perspective. And one of the things I can do is look at how much people are talking about something on social media. That's easy to do. And I think you'll agree those numbers are fairly good. I'm hoping to reach the 1 billion Twitter impressions after the tour, so fingers crossed. It's also been a big part of NHS Change Day, because it really sits with the NHS Change Day ethos of making a pledge, a simple pledge, personally, to improve care at the front line. So it really sort of resonates with that ethos. So we had 20,000 people sign up to the Hellomynameis pledge last year. This year it formed the basis of many personal pledges, and I took part in the Change-a-thon. The 2nd of February marks a big day, and I know that day when you launched Hellomynameis here, but everybody else did across the country as well. And it was a big day personally, because I got up very early, I went to BBC Leeds, and I was interviewed on the Today programme and then the 5 Live breakfast show. Then I got the bus up to St James's, I'm a Porter cath accessed, and I started my chemotherapy. I then continued on the phone doing various interviews on my mobile until Radio 2 phoned me and said, would you like to come on Jeremy Vine this afternoon? But we need a landline. So I had to go to Sister Claire and say, please can I use your office? And Claire said that was the most bizarre request she'd ever had from a patient. But why was the media interested? So together with the Listening into Action network, we'd written to every single chief executive in the country and asked them if they wanted to get involved with Hellomynameis. We got over 100 responses back saying, yes, of course we do, let's do this. And the date chosen unfortunately happened to coincide with my chemotherapy, but it was just amazing. My phone kept buzzing all day long. It was burning hot. It was receiving so many Twitter notifications and pictures. It was such an extraordinary day to see the whole NHS at its best. And the media were interested, which was fantastic. How often do we get a positive news story into the media about us all working together to improve patient experience? So I was very happy to do all the interviews. I also was happy to do the interviews because it raises the public profile of the campaign, and it gets to raise patients' expectations that this is something that they can expect from us, and that's what we should be doing, and kind of empowering them to remember to ask us if we forget, and putting us all on the same level playing field, I guess. So the 2nd of February was a big day. It's already been alluded to in the introduction about Hellomynameis going global, but it has. And it's amazing that it has spread to Johns Hopkins University Hospital, to Canberra in Australia, to Christchurch in New Zealand. It's the power of sending one tweet. It reaches the whole planet. So we've had lots of action across Europe. We've had lots of action in Italy recently, which is fantastic. And the story about Sierra Leone's already been told, but I was so humbled when I received that email telling me that the Sierra Leone volunteers were getting involved, because they have so many physical barriers between them and their patients, and it was just such a lovely expression of the campaign in what must be incredibly difficult circumstances. So we're on tour. This is my 13th talk of 16, so I'm starting to lose my voice. This was again the brainchild of Chris. We were having a conversation about how we could keep momentum going for the campaign, keep people talking about it, keep pushing forward to keep change happening. And Chris had the idea that maybe the most powerful way, Kate, is for you to get out there and meet as many people as you can. So I'd get an awful lot of requests to do talks. So we decided that we'd sort of combine them all into one big week of lots of talks. So I sent one tweet out saying, would anybody like me to come? And I got 73 requests. So it was very hard trying to work out the logistics of today. So it's taken a lot of emails flying around the place to get me here and Chris here today. But it's been amazing working with people, and we've had such a fantastic response from every organisation we've been to. It's been extraordinary. But why does this matter? Why am I dragging Chris on his week off around the country with me? Why am I spending my time doing this? I believe in healthcare particularly, an introduction is far more important than just common courtesy. It's not just good manners. It's about how we make connections. So we've got a human being who's suffering, vulnerable and frightened, and we've got a human being who wants to help that other person. And in order to do that, we need to make connections. We need to build relationships, often quickly, in stressful circumstances. And the way we can do that is by starting with our names. It starts us off on the right footing to provide proper, compassionate care. I don't think you can get much further if you don't provide your name. And I really believe it's central to what we do as healthcare professionals. When I saw this tweet a few months ago, I was worried. I was really worried that Hellomynameis is becoming corporate. It's becoming about having a logo, a fancy lanyard, or really chic posters on the wall. But it's not, is it? Hellomynameis is about an individual choosing to behave in a certain way towards the people that they're looking after. And I don't want to be receiving tweets like this anymore. So my plea to you today is to take what I've said, think about it, and take it back into your own workplaces, talk to your colleagues, and try and spread a message of person-centred care is really what we're all striving for, to make care better for all our patients. Because if we do, then this is the sort of feedback then we start to get. This person sent me their friends and family test card on Twitter, and they said they've clearly made connections with people. They remember the names of those people while they were going through that surgery. They've made connections. So it's not just about us making the experience better for our patients, it's also about us improving the satisfaction with our work. Because I don't think you can really get true satisfaction from working in healthcare if you hide behind NHS anonymity. So in order to receive feedback like this, then you kind of need to tell people your name, don't you? So what does the future hold? My future is very uncertain. I probably only have months to live, although I've really defied the odds so far. 3 years past my sell-by date, and who knows how much longer I'll live for. But I remain an ambitious individual. I have ambitions for this campaign. I'd like to be able to walk into any healthcare organisation and ask any member of staff what Hellomynameis is all about, and them to be able to tell me. There's 1.2 million of us, so I'm not sure I'm actually going to achieve that, but I'm going to keep trying while I can. And you might say, why? Well, I think it's all about legacy. I can't stand the thought of people feeling sorry for me and me becoming that tragic young doctor who died of cancer before her time. I really want to become somebody who changed the health service for the better, that made us all a more positive place to work, and really pushed patient experience and compassion to the forefront of everyone's thinking. So I'm going to shut up now. No talk of mine will be complete without a tiny plug for my books. I've written 2 books about my experiences, and hopefully I'll finish my 3rd before I pop my clogs. But it's all in an endeavour to raise money for our local cancer centre, which is an amazing charity that really improves the quality of life for patients in Yorkshire. I know that because I've been on the receiving end of the amazing work they do. So Chris and I are up to £170,000 and we'd like to make that £250,000 before I die. So if anybody would like a little read, then please have a look. We've got some leaflets about the website as well. Thank you for listening.